The best way to massage a person's legs for better circulation is to begin with a comprehensive plan in mind and then to work that plan to its completion. Circulation difficulties are common in the leg, since blood and nutrients have to travel such a distance from the pumping heart to reach the entire leg. In addition, the returning deoxygenated blood must rise against the pull of gravity to return to the filtering organs and heart once again. Massage is an excellent method for enhancing circulation. The therapist should work both legs. The gastrocnemius is located with the soleus in the posterior compartment of the leg. It originates from the posterior, back, surfaces of the distal head of the femur. Its other end forms a common tendon with the soleus muscle. This tendon is known as the calcaneal tendon or Achilles tendon and inserts onto the posterior surface of the calcaneus, or mountain bone. Deep to the gastrocnemius, farther from the skin, is the soleus muscle. Some anatomists consider both to be a single muscle. The triceps zur, the plantaris muscle and a portion of its tendon run between the two muscles, which is involved in locking the knee from the standing position. On the other side of the fascia are the tibialis posterior muscle, the flexor digitorum longus muscle, and the flexor hallucis longus muscle, along with the posterior tibial artery and posterior tibial vein and the tibial nerve. Since the anterior compartment of the leg is lateral to the tibia, the bulge of muscle medial to the tibia on the anterior side is actually the posterior compartment. The soleus is superficial midshaft of the tibia. Frequently there is a sesamoid bone called the fibella in the lateral head of gastrocnemius muscle. You will need to use a combination of pressure and friction to cause the circulatory vessels to increase in diameter and permit additional blood flow. Most massage therapists begin with long strokes to warm the tissue throughout the target area and then continue with deeper pressure and shorter, more stimulating techniques. The gastrocnemius muscle is very prone to spasms, the painful, involuntary, contraction of the muscle for up to several minutes. This muscle is prone to injury called torn calf muscle, which is disabling. The gastrocnemius muscle may also become inflamed due to overuse. Anti-inflammatory and physical therapy may be necessary. Anatomical abnormalities involving the medial head of gastrocnemius muscle results in popliteal entrapment syndrome. Begin at the top of the thigh, then move down approximately 12 inches and cover both this new area and the area initially worked. By continuing to add additional areas, circulatory pathways are opened up, bringing new circulation down into the leg and simultaneously encouraging flow in the vessels returning to the heart from the leg. Gradually move down to the ankle and the foot. Once the tissue of the entire leg has been warmed up, use long strokes of moderate pressure, alternating with shorter, more intense strokes. Use small friction strokes of moderate intensity to bring the increased flow down to the foot. So for the back of the legs, I've applied a lot of lotion. We have a broader area to cover on both men and women, so make sure you have a lot of lotion. Go ahead and give nice coverage first with Swedish massage. You want to get that tissue warmed up, and then you're going to go ahead and use that forearm. At first you're going to want to use a forearm instead of an elbow because you're going to want to make sure that you don't go in too deep too fast. When you get up to the base of the glutes, there, right where the bone is, you can sort of rest there for a minute, and it's nice to do a little swoop around the hip joint. Whenever you're working on the limbs, the arms or the legs, you're always going to want to do the direct pressure towards the heart. So, at any time, if you're applying a deeper pressure, make sure you go towards the heart, never away. You can do lighter strokes away, but it's really important to keep the blood flowing towards the heart. The importance and relevance of leg massage is best understood by those who stand for long periods during the day. A well thought out and well implemented leg massage goes a long